also announced our framework to lower health care prices for all Americans, including those in rural America. And we're calling it the Great Health Care Plan. You know, we had to come up with a name, and everybody wanted to say, oh, well, can we put something about lowering costs, because we're lowering costs very substantially. So I had Bobby, and I had Oz. We had everybody in there. We had a whole group of people, and we're trying to come up with, so we're saying, the cost reduction plan that gives you good health care. And I said, it's too long. It's not going to sell. I said, we had more plans. And they wanted to get the words cost reduction in there, Lola, especially you. They wanted cost reduction in, and then they wanted great health care in. I said, look, you can have one or the other, but it gets too long. We're talking about the name of a plan. So we got it down to 7 or 8 words, and which is far too long. Nobody can remember that much. And I said, how about just call it, because this is the Great Health Care Plan. Now, a great plan has to be cost-effective, otherwise it can't be a great plan. That's the way I looked at it. So we have a very glamorous name. It's called the Great Health Care Plan, not the Unaffordable Care Act. I don't like that name. This is called officially the Great Health Care Plan. That means low price and great health care. So you're going to have, at a lower price, great health care.